To explain a few things, first of all, I'm a physician. I'm an emergency physician here at George Washington University Hospital. I'm an associate professor and I'm the director of the Disaster and Operational Medicine program. I am not a digital cybersecurity expert. I'm a disaster person. And it might come into your mind, why in the heck are you up here talking that? And I'll get to that. I got to say thank you to the previous speaker, Mr. Rigi. That was a perfect transition into some of the things that I'm going to talk about here. Because some of the things he was showing, like the Kaiser hazard vulnerability analysis matrix that he showed, that's our wheelhouse. And that's fantastic to see. So here at GW, I teach disaster medicine to emergency physicians who have already finished their residency. We teach it within the medical school. You've seen several of our students and our residents here today participating. Including my fellow Larissa Unruh, Dr. Unruh, who's here, you may have met out front. I want to thank her and the rest of our GW team that played a small part in getting this put together. I want to give a sincere thank you to each of the speakers and guests, and a special thank you to Senator Warren and Representative Kelly for taking the time to not only address this important topic, but even their presence lends credibility and makes it apparent to us, provides us hope that we're being listened to at the highest levels of our federal government. So anytime you can get your elected officials in the room to hear these things and to support your efforts, that's a major step. I recognize that living in Washington, DC, and I know from Jeff and Christian and his team, their team, that this was part of their goal of bringing CyberMed to Washington, DC last year, was to continue to grow that audience, and we look forward to doing this again. Thank you to Jeff, Christian, Bo, Josh, Panda, and the rest of your team for your dedication in producing this important summit. Thank you to the specialists in the GW Simulation Lab for your time and the space you provided us. Thank you to Dr. Aman Hussain, who graciously served as our unprepared simulation physician after being voluntold that he would do so. While he treated 2 sick patients, certainly he was the real victim today. Thank you to our esteemed colleagues at the Engineering and Applied Sciences School for their contributions and for providing this space for us today. And thank you to all of you who traveled not only from around DC, but from across the United States. It's been great to meet some of you today, make new friends, and hopefully partners in collaboration moving forward. So why am I here? Let's get to that quick. What is disaster medicine anyway? You've learned a lot about emergency medicine today for those of you who may be non-medical. We are the few, the proud, and the weird physicians in this country, specially trained with a focus on improving the medical capabilities and response to disasters of every type. This includes natural disasters like earthquakes and hurricanes, tornadoes, and the occasional global viral pandemic. It includes accidental disasters that lead to mass casualties like the structural collapse that happened yesterday in New York, train derailments, industrial explosions, and the like. My primary interest is the more nefarious category, which are intentional man-made events, which include bombings, mass shootings, targeted vehicular rammings, chemical attacks, and on and on. We call these events disasters because when such an event occurs, there's an almost immediate imbalance between 2 things. One is the needs of the patients. What are the medical needs required from the people who have been affected by the incident? And the other is your available resources that you have on hand. And when you have such a shift in that imbalance, it becomes a disaster. It means that you have to go outside of where you normally work to ask for resources, help, as was alluded to in the first talk, I believe, from Josh, what we call the 3 S's, space, staff, and stuff. And when you need additional space, staff, and stuff, that means that you have a disaster. And fortunately for us, that can be just within your hospital, but even your local partners can come in to help. That can go all the way to a regional and a state, and even an international level if it needs to. Think of the Haiti earthquake. That is just a massive scale of what happens in a hospital when there's a disaster. And so how does cybersecurity fit into that? Well, I think that it's important, and I'm trying to bring this into our scope of practice in disaster medicine, is that when a cyber attack occurs, maybe not a device attack, but if we're talking about a ransomware attack that takes out the systems of your hospital, and that's something that I experienced here in our own hospital system in the midst of the pandemic. What we experience is that you may have the same number of patients with the same number of needs, but when you have a sudden and calamitous drop in your resources, that's the same thing. It's just tilted in the other direction. So you have an instant disaster on your hand, and that belongs in our wheelhouse. So what is the wheelhouse of disaster medicine? It's about preparation and mitigation, hopefully prevention, because we realize that every dollar that we spend to the left of boom, before that explosion, that mass shooting, or that ransomware attack, that's worth $10 over here to the right of boom when you're trying to recover and respond. It sounds sexy to be jumping into a helicopter and jumping out into a country that's experienced a massive disaster and you got a backpack full of medical supplies. We would way rather not be doing that. We'd way rather have rebuilt the levees in New Orleans so that those disasters didn't occur in the first place. So the same thing applies, as far as we're concerned as sort of non-cybersecurity experts, to healthcare in general when it comes to the vulnerabilities that our hospitals experience. It was a really important point that someone asked of Dr. Hussein when we were up here following his simulation. He was asked, do you have a seat at the table as a physician? And he said, I don't know, it's above my pay grade. I'm a PGY2 resident. Well, I'm not a PGY2 resident. I'm an associate professor, and I can tell you, I don't know who has that seat at that table from a clinical standpoint. And I think that we deserve to have it there, just as I feel that way about all disasters. We have a number of things that I think we can be doing to improve the ultimate issue, which is patient care. Any successful terrorist attack, any successful terrorist attack ultimately becomes a medical problem. The buck stops here with medicine. And when we're talking about a cyber attack directly on our medical infrastructure, especially as we experienced in the middle of a pandemic, it's not just evil, but it's deleterious to patient care. And so there's a number of barriers that we have right now that are limiting our ability to fully understand the scope of the magnitude of impact that these attacks are causing directly on patient care. There's certainly a great start with the reporting at HHS for these attacks where privacy is involved and where records are taken. But I think that there's additional steps that need to be taken. And we'll talk about that as we look towards the future. The good news is I don't want to be all gloomy because that's what disaster people do. We think about the worst stuff all day long. As an emergency doctor and a disaster doctor, everything in my brain is always the worst case scenario, right? My poor kids, they're 5, 3, and 1, and I'm going to chop up their grapes and their hot dogs until they graduate high school. Like, there's no possible way, right? And so what we do is we have to take a look at all of these different types of disasters and how that threat landscape is shifting, right? We've spent the last 20 years of our sort of national posture focused towards counterterrorism. And now we're starting to see that multiple federal agencies, both the IC, the DoD, everybody is like, hey, now we're shifting back towards nation state stuff, right? And the same thing sort of exists within the cybersecurity world, but you all have to be postured against all of them all the time at 100%. Whether we're talking about those lone actors, we're talking about APTs, we're talking about nation state actors who are constantly attacking us here. As we said, 58% are Russian speaking. So we know who our adversaries are, but thank goodness we have people on the cybersecurity side who are focused on all of those different threat levels and postured against them constantly. So what comes next for us? Well, I think that as ER doctors and disaster experts, we need to start incorporating this in a more granular level into the education of physicians and healthcare providers. We need to have a seat at the table within our hospitals and healthcare organizations about how this directly affects our patients. What we have is reporting about privacy, but what we don't see is the ability to research the effects of a cyber attack on a hospital and how it affects individual patients. We have a lot of metrics that we use in emergency medicine. Door to balloon time or door to TPA time for a stroke or for a heart attack. That's a metric that we measure. You need 90 minutes, you need that balloon in the heart to open up the artery. You need certain antibiotics by the time sepsis is recognized. But you know what disrupts all that? Losing your ability to view an x-ray. Losing your ability to get into a patient's chart to see what their medical history is. I've experienced this. But what we need as a barrier is our ability to actually measure that data and see how these attacks disrupt patient care so we can have data to study and figure out how to mitigate against it. I think some of our barriers, it's pretty clear, medicine has become industrialized and companies are afraid to be vulnerable. And I respect that, I get where that comes from. But if you put up a barrier that says I can't look at patient data because it might expose you potentially to liability or to bad publicity, that's hard for us as physician scientists. And so I hope that as we turn towards the future, we not only increase transparency in all forms of cyber attacks against hospitals, not just those that involve privacy, but also that we are we're really starting to address the ability to analyze our data during attacks. As we look forward to the future, the other things that I think as physicians we're going to be keeping our eyes on, first and foremost, the world has finally been introduced to AI at sort of a personal level. Everybody in here probably has ChatGPT, right? We're all experiencing that one little narrow aspect of what artificial intelligence is, not even the really big, interesting stuff yet, right? It's already disrupted the academic environment thoroughly. Within a week of ChatGPT coming out, we were receiving academic emails from the university saying people are going to start cheating on everything. Be ready for it, right? So academia will never be the same. High school will never be the same. There will be no more writing assignments unless it's in person with a pencil. My, how we've come back to history, right? And so we can't even begin to imagine some of the ways that new forms of AI are going to disrupt medicine and cause cybersecurity vulnerabilities for us that we can't even imagine yet. I will predict that at CyberMed 28 here in Washington, DC, that AI is going to be a very major topic of what we're discussing 5 years from now. That plus the great leap forward that we took in telemedicine during the pandemic means that we, as our standard of care in medicine, are becoming increasingly reliable on both technology and connectivity, both as patients and providers. And of course, because we're going to be interacting with our patients in a digital world, that means that those vulnerabilities for both privacy and security are going to become exponentially more. And so thank you for coming to this event. Thank you for allowing us as the disaster section to partner with CyberMed. What an amazing organization. With all of you who from the engineering school, thank you. And I've learned so much today, and I'm really honored to get the opportunity to say my piece and maybe be some thought-provoking things to you all. So with that, thank you from GW, and I'll turn it back over to Josh.